Good morning all the students. Today we will be studying about what is child psychology. So today we will be covering these contents. So what is psychology? It is defined as the study of behavior and its related mental processes, whereas child psychology is the branch of science dealing with the study of nature, function and phenomena of child's souls and mind. And Kenneth Clark and George Miller has said it is the science that deals with the mental power or an interaction between the conscious and subconscious element in a child. So what is the importance of child psychology? Why we should study it? For better understanding of the child, establish effective communication, gain confidence of child and parent, provide a comfortable environment. Effective treatment planning and execution, deliver dental service in a meaningful way, better teaching of primary and preventive care, and no problems of psychological origin. So how can we classify the psychological theories? We can classify it as psychodynamic theory, behavior learning theories and other theories. So among the psychodynamic theory, these are archaic discharge syndrome, psychoanalytic or psychosexual theory, psychosocial theory and cognitive theory by Jean Piaget. And behavioral learning theories are classical conditioning theory by Ivan Pavlov, by B.F. Skinner operant conditioning, social learning theory by Albert Bandura and hierarchy of needs by Abraham Maslow. So coming to archaic discharge syndrome, it is the theory which is put forward by Sigmund Freud in 1900s. So he is also known as the father of modern psychiatry. It suggests that the human body contains two types of neurons. One are the sign neurons and one are the fine neurons. So what in the sign neurons, there it contains the storage of emotions. All the emotions which we have inside us, it's stored. Whereas fine neurons are conduction of emotions. Like sometimes we get angry, so we yell on someone. So it is because of fine neurons. So when emotions reaches a certain level, a discharge is sparked off, which is also known as archaic discharge. So psychoanalytic theory is given by him, and he's born on September 23, 1939. So Sigmund Freud has given three components of personality. It is based on the fact that the behavior is determined by powerful inner forces which are most buried in the unconscious mind. And he advocated method of free association, which means that person can speak whatever that comes to his mind, regardless is how trivial or embarrassing it may be. So it is the iceberg phenomena. In this, it depicts that this is our ego, this is our id and this is our superego. So what is id? Id are the basic desire, it works on pleasure principle. And ego, superego are the moral values which are imbibed in us, given to us by our adults, by our teachers, etc. And ego is the relay station between id and superego. So what we see above the iceberg is only the ego. And id and superego lies in the unconscious or subconscious mind. So this is the structural theory of mind, which contains the pleasure principle, that is id, reality principle, that is ego, and superego, which is the perfection principle or the moral principle. So id is unregulated instinctual drives and energies striving to meet the bodily needs and desires and are governed by pleasure principle. They are dark, inaccessible part of the personalities. So it is present at birth, it is impulse ridden or instinctive, it strives from immediate pleasure and gratification, it operates under the primary process and lacks the capacity to delay and modify. It has only unconscious component, it might be immoral or illogical. Whereas ego is the reality principle. So ego is the mediator between id and superego. it channelizes it into socially acceptable way and working in the service of reality principle. So what are the functions of ego? It control and regulate the instinctual drive, the judgment and relation to reality. Then comes the superego, which is also the moral principle. So it is the moral arm of the personality. It develops from ego. It represents ideal rather than the real, and it strives for perfection, inhibit of impulses of instinctual drive, and develops around 5 years of age. It acts as a conscious value judgments, and Freud believed that many personality disorder come because of conflict between ego and superego, and ego also develops defense mechanism to hide from the superego. So what are the interaction? It is the legislative, ego is the executive, and superego is the judicial. Then we come to the psychosexual theory. So a theory of energies or drives is which he has known as libido. So libido was originally designated to represent sexual drive and energy. The definition was later broadened to encompass all the pleasurable activities. So he has given various stages: oral stage, anal stage, urethral stage, phallic stage, latency period and genital stage. So first we come to the oral stage. It is the earliest stage of the development in which the infants need perception and modes of expression. So it is so they are called primary zone of pleasure when the child is from birth to 18 months of age. The baby derives its most intense pleasure from oral sensation like thirst, hunger, thumb sucking, nursing, chewing, biting, splitting and crying. The characteristic trait is, if the mother responds to the needs of the child, then the child feels that I am loved, cared, and my parents are responsible. So both insufficient and forceful feeding can result into fixation. Then what happens if it is fixed? Then the child may be a thumb sucker, may have a habit of smoking, biting the pencil, nail biting, etc. Then comes the anal stage, which is from 18 months to 3 years, when the child is toddler, when he learns to walk, when he moves around. So erogenous zone is anus. At that time, it is basically the stage of toilet training for the child. So erotication of anal stage involves both pleasurable sense of excretion and later erotic stimulation through retention of feces. And it is prompted by maturation of neuromuscular control over sphincters. So pathological trait is overemphasis on toilet training leads to obstinate, compulsive, perfectionist behavior in later life called anal personality. Anal expulsive personality is there and anal retentive personality is there. Then comes the urethral stage. It is a transition between anal and phallic stage. It derives pleasure by exercising control over urinary sphincter. Objects similar to anal stage and loss of urethral control is there. Then comes phallic stage, which is between 3 to 7 years of age. The main objective, the child enters the phallic stage in when the genital organs are the prime erotic zone. It explores, they play doctor-nurse games and explore different parts of the body, genitalias. This stage is finding a love object from which a basis of choice in the later life. So, in this stage, we come to two different complexes, which are Oedipus complex, which is seen in boys, and Electra complex, which is seen in female. So, young boys have a tendency to be attached towards their mother and they consider their father as an enemy. A little boy adopts his father's manners, his attitude and interest, thinking that by becoming like his father, he can win the mother's love. and Electra complex is developed in the female child. Usually a female child develops love towards father, being possessive, repeats the action of mother to impress father, and if the fixation of this complex is seen when adults try to see their father-like image in their partners. Then it also have seen along with the castration anxiety. Then comes the latency stage, which is from 7 years to 1 year of age. Resolution of any defect occurs in this phase. The phase ends in puberty and maturation of ego takes place. There develops a greater degree of control over instinctual impulses. Followed by genital stage, psychosexual development extends from 1 year to 13 years of young adulthood and a sense of identity develops. Child has a matured personality, he can satisfy his genital potency and realizes his goal for the reproduction and survival, helps to separate from the dependence on parents. Boys become shy of girls and girls become shy of boys in these stage, and more interaction with the opposite partners is seen during this stage. But what are the limitations of this theory? It overemphasizes to infantile sexuality, overemphasizes on difference between man and women, unconcerned with interpersonal relations, individual identity, and he has not considered the role of society in the development. So, with this, we complete today's lecture. Thank you.